All right, so if you're joining me and you clicked on the link, then I'm assuming you either have shoulder pain or a shoulder condition and you'd like some guidance, or maybe you're just interested to see what I'm posting online. Anyway, I appreciate it. Please like, follow, share as you will. Let's talk about the shoulder very quickly. There are a few self-assessment items that I'd like to cover. These tests are part of a cluster of tests that I use clinically, but you can perform that at home without any equipment to better help understand what might possibly be going on with your shoulder. They're not all 100% accurate, but they give you a rough idea of what the underlying pathology is. Either way, if you're experiencing a shoulder problem and you'd like an opinion, a professional opinion on that, please do not hesitate to contact me. You can reach me by phone, by email, through my website or online, and I'm happy to help guide you. So let's start from the top. If we're looking at a rotator cuff tear, whether it's a large tear or a small tear, the best test that I like to use would involve the following. So massive tears are pretty clear. If you have the inability to elevate your arm to 90 degrees and you notice some compensatory movement by shrugging of the shoulder, well, that would be a positive test for probably a large rotator cuff tear, and that's something I would definitely need to look at. But other tests, just to see if the rotator cuff is involved, would involve this. If you took your palm, faced your thumb downward and made a fist, and you provided pressure on that arm, if you have the reproduction of pain or the inability to hold that position, that would be a positive test. The other test would be what's called a drop arm. So if you elevated your arm up overhead passively, let it go, and tried to slowly lower the arm, if you had the inability to hold that, or again, the reproduction of pain, that's a positive test. Other tests would be pressing on your stomach. If you have pain or the inability to do so, that would be a positive test. And lastly, the arm behind the back, trying to lift off. If you have the inability to do so or the reproduction of pain, that's a positive test. So that would cover rotator cuff. When we look at impingement syndrome, what occurs is you experience pain or a pinching type sensation with certain movements of the arm. My go-to tests look something like this. If you brought your arm into this position, pressed down and tried to internally rotate your shoulder, if you had the reproduction of pain in that area, that's a positive test. Secondly, if you elevate the arm with your palms down, if you get a pinching sensation deep within that shoulder with palms down, and then if you turn the thumb up or even palms up and that pinching sensation goes away, it's a positive test. Lastly, for impingement syndrome would be what we call a painful arc. Now this is just simply if you have pain right around 90 degrees, you still have pain, and then it goes away at 120 and above, it's a positive sign for impingement syndrome. When we look at biceps tendinitis, this falls in line with also impingement syndrome, but again, you're going to have this deep kind of irritable pain when the arm is positioned somewhere in space, or if you're lifting objects, you're going to feel it on the front side of the arm, deep within that shoulder joint. But most oftentimes, if you reach across the body like so and you're feeling a pinching sensation there, that would be a positive test. Now, lastly, adhesive capsulitis. This one, for most individuals, happens out of nowhere. We have no explanation for it. There is a genetic component, there's a hormonal component, there's an age component. But the bottom line is, no matter what stage of the freezing shoulder process you're in, you're either going to have pain or not, but you're going to have significant loss of motion in multiple directions. And what I typically would see, and you can do this at home, is if you're unable to elevate your arm, if you have difficulty reaching across the body, behind the neck, or especially behind the back, if one or a combination of those are painful or they feel stuck, it's usually a hallmark sign that you've got some stage of adhesive capsulitis, and all the more reason to seek counsel here. But anyway, try those at home. See what you think. If any of those are bothersome and you have further questions, do not hesitate to contact me.